Your nervy arm and shoulder pain can easily lead to multiple surgeries and thousands of dollars gone if you don't take care of it now. And what's worse is finding the source for your nervy arm pain is difficult, which means it can take your doctor years just to figure out what's going on. And that's why in today's video, I'm going to be showing you how to get rid of your nervy arm pain using what's called a nerve floss technique. And if you've already tried it or it didn't work in the past, then stick around to the end because I'm going to be showing you how to upgrade the nerve floss so you can actually feel a difference. Adam here from TOStreatment.com. Now there's two reasons for you having nervy shoulder and arm pain, with one being that most people know about and the other one being something that most people don't know about. And the most common reason for your nervy arm and shoulder pain is going to be tight muscles creating compression on the nerves, resulting in your pain, with some of the most common areas being the neck, chest, shoulder, and the arm. And this can happen thanks to all kinds of reasons like bad posture, repetitive injuries, or just overuse. And if you fit in any of those categories, then a nerve floss might be right for you. Now, right now, I'm going to be going over 5 different nerve floss techniques for your different nerves and the brachial plexus. And then after that, I'm going to be showing you the other reason you can get nervy arm and shoulder pain and what you can do to actually feel a difference. Now, the first one is a ulnar nerve glide. And the ulnar nerve is the one that runs in the pinky on the medial side of the body when you're looking at it in anatomical position. Now your starting position is going to be either in a sitting or standing position. Just make sure you're comfortable. And what you're going to do is start off by making the OK sign by placing your pointer finger and your thumbs together. Now from here, the initial movement is to flip the OK sign inwards so that the thumb is facing up and the pinky is pointing towards you. And you're going to do this a few times just to make sure that you are able to go on to the next step, because a lot of you may not be able to get past this initial movement. And if that is you, make sure to stick around until the end so you know how many sets and reps and things to do for your different techniques. But if you don't feel any pain just doing this, then what you're going to want to do is simply go all the way around until you're making the Batman sign, and you go all the way and cover your eyes pretty much. So the idea here is that we're just stretching the tissues and allowing the nerve on the medial side of the body, on the pinky side, to get stretched out and move back and forth. Now up next is the medial nerve, which is the one that runs right down the middle. So the starting position for this is again sitting or standing, but now you're gonna have your arm out to the side with your palm facing up. Now with your fingers straight, what you're gonna do is extend the wrist by trying to point your fingers down towards the floor. Hold for a few seconds and then let it come back. Go ahead and do this a few times and you can consider this level 1. Now if you're okay moving up, what we're gonna do now is as we extend the wrist down to point the fingers down, we're going to laterally flex our head to the other side at the same time. Again, this is going to help stretch out the muscles around those nerves, which will hopefully allow it to move easier and not create that compression. So you have version 1 with just the wrist and version 2 with the head tilt and the wrist combined. The last one is going to be the radial nerve, the one that runs on the thumb side. And this one is pretty much the same exact thing as the medial, except now we're going to go palm down and we're going to flex the wrist down now. So those fingers are still pointing downwards. Again, level 1 is just simply doing the wrist movement. If this is too much, then just stick to this level. But if you're okay moving forward, then the next position, the next step is going to be to laterally flex the neck to the other side. Again, you're going to do both of them at the same time whenever you do these movements. Now here we have 2 different kinds of nerve floss techniques for your brachial plexus, meaning the nerves up in the shoulder and chest region. So to start off, we're going to be doing number 1, which is called the brachial plexus floss number 1. Start off by laterally flexing your head to the same side that you have pain and keep it there. Now from here, you're going to curl your wrist, flex the elbow, and you're pretty much going to curl the body all the way in until your fist is touching your chest. Make sure your head is still tilted to the side. From here, you're going to uncurl the wrist all the way down until your fingers are now extended, palms facing forward. From here, elevate the arm as you internally rotate the arm, which means you now have your palm facing down. And then from here, you're going to extend the arm back as far as you can until you are not able to go anymore, until you are in a comfortable position. Now from this position, you're going to extend the wrist by pointing the fingers up, and at the same time, laterally flex your head now to the opposite side. From here, you go back to neutral and even tilt your head back to that same side. And again, laterally flex to the opposite side as you extend the wrist, fingers pointing up. Now, this is how you perform the brachial plex floss number 2. This one's going to be very similar to number 1 with just a few small tweaks. Start off by curling the wrist in and then curling the elbow, bringing everything up to the chest and then back down. You can think of this initial movement as a warm-up to the actual stretching portion of the floss technique. Now from here, you're once again going to get the arm and extend it to the side, but this time you're going to have palm facing up. So my arm is all the way back, palm facing up. And now we're going to do the same exact thing like we did with number 1. We're going to laterally flex our head to the side and we're going to point the fingers up. And now we're going to go back down and back up pretty much. Talking about the fingers, not my head. So pretty much whenever your wrist comes up, your head flexes the other way. When your head goes back, your wrist goes back down to neutral. Now, whichever floss technique you want to do, the goal here is to do about 2 to 3 sets for 10 to 15 slow reps. Do not feel like you need to rush through these. Take your time and try to breathe throughout these different techniques. What if you've already tried these or you want to make it feel even better? Well, then you need to learn about the second reason you can have nervy arm and shoulder pain, and that is because of trigger points. Trigger points are small little areas in the muscle that become chronically contracted, and not only can it create pain where it is in the muscle, it can also create what's called referral pain, which is pretty much pain that goes in different areas of the body. And one thing about trigger point pain is it can feel like nervy and burning pain, which means you can think that you have some kind of entrapment in the nerves somewhere in the shoulder or something, or the arm, when in reality, it's actually a trigger point maybe in that area creating referral pain that feels like nervy pain. This means that you're not only going to be able to work on those trigger points, you're also going to be able to massage out and loosen the muscles that are tight and creating that nervy pain in the first place if your issue is from nerves getting compressed. So by doing this technique, you're basically doing a 2-for-1 deal here. You're getting rid of your trigger points and you're also loosening the muscles. So with that said, let me show you the top 5 areas that you should be massaging and how to do these different techniques. The first one is going to be your scalenes. This muscle is located on the side of your neck, and it's one of the main areas that all your nerves and blood vessels come through that go into the shoulder and the arm. And because we use our neck every single day for driving, for texting, for working on the computer, it is very common for this area to get tight, which means it can create the compression, create trigger points, and therefore create your pain. And to begin massaging out this muscle, use your fingers and just begin looking for the most tender spots as you begin working on the lateral side of the neck. Don't be worried about hitting nerves and other things like that. You don't need to press in too hard here in order to work on the muscle. And once you believe you found a tight spot, a trigger point, something that feels painful, or maybe even something that creates pain in other areas of the body, then you have 2 options. One, you can either just try to rub it out with what I like to call micro movements by going back and forth and side to side, or you can do what's called a pin and stretch by pinning down that tender spot and then stretching the muscle by laterally flexing your head to the other side. Either one, you're going to want to do these massage techniques for about 2 minutes on each muscle. The next step is going to be the pec major and the minor. In order to release this muscle, I highly recommend using something like a foam roller or a 5-inch ball. Go ahead and begin looking again for the most tender spot you can find within the pec major, focusing a little more on the top region of the chest as opposed to the lower portion, even though there's probably a lot of trigger points there too. And once you believe that you found a nice tender spot, you can again perform either micro movements by going back and forth and side to side, or you can do a pin and stretch by taking your arm and swinging it through its full ranges of motion. Not swinging, of course, but moving it. Now from here, shift over to your shoulder. And again, same exact thing here. Focus on the shoulder, look for the most tender spots, and either just work on it for the next 2 minutes or do a pin and stretch by keeping it pinned down and then taking your arm through its full ranges of motion. Next up are your biceps, and in order to massage the muscle, you can either use your hands or you can use a smaller ball in order to press into the bicep and again massage it out. Once again, look for the most tender spots, perform micro movements by going back and forth side to side, or do a pin and stretch by starting with the elbow flexed, pinning down that tender spot, and then stretching the arm out in order to stretch the bicep. And now go ahead and massage out the forearm the same way you just massaged out the bicep. Look for a tender spots, perform micro movements by going back and forth and side to side, and then do a pin and stretch by starting with the passively flexed, pinning it down, and then stretching the muscle out by extending the wrist and pointing the fingers away. Once again, your goal here is to do a massage technique on each of these muscles for about 2 minutes, giving you about a 10-minute self-massage routine here. Now go back through your nerve floss techniques and let me know how it feels after releasing not only the trigger points, but the tight muscles around that nerve. Now, if you want to learn all about this nervy kind of pain, how it's created, and how to really get rid of it, then check out my free training in the description below. Or if you want to try a similar treatment plan just like this, then make sure to click on the video in the top corner. I'll see you over there.